My name is Brian Bergmark. I am an interventional cardiologist at Bergmark Hospital and investigator at the TIMI study group. In this study, we looked at a subgroup of patients from the VESALIUS-CV trial, which examined Evolocumab versus placebo in patients at heightened risk, but who had not had a prior myocardial infarction or stroke. This is an important question because these patients are commonly encountered in clinical practice, patients with a prior PCI but without a prior MI, and they are a group who might stand to benefit particularly from aggressive lowering of LDL cholesterol. When we looked at the patients with prior PCI compared with patients without a prior PCI, those who had prior stenting were indeed at higher risk for cardiovascular events, including major adverse event composites, as well as coronary specific events. In addition, these patients had substantial reductions in their LDL cholesterol levels with Evolocumab, down to levels of about 40 milligrams per deciliter or 1 millimole per liter. And finally, accompanying these changes, there were marked reductions in the risk for cardiovascular events from the broader composite endpoints to, again, coronary specific events, such as STEMI and STEMI. These findings indicate that these patients with a prior PCI, but who have not otherwise met criteria for very high risk, for example, with a prior MI, are indeed at heightened risk and are readily identifiable in clinical practice. We take care of these patients every day. And the study indicates the substantial clinical benefit for aggressive LDL cholesterol lowering with Evolocumab. Thanks very much for your attention.